Good evening to all the viewers who are watching live and will be watching on the recorded version. This is me, or Mukherjee, with you with a brand new CME. And again, we are sorry for so much delay. And one more thing to say before starting that we are facing some technical issues with that auto e-participation certificate. So we are trying our level best, and we have given to a best team to just check on that. I hope they will get soon, and please do keep an update on our join our WhatsApp channel so that you just stay updated for that thing too. So with this, without wasting any more time, let's just jump into our 30 seconds countdown time.
Good evening, everybody. Due to some technical challenges, we are not having with us immediately our president, Dr. Devnana Kalyani, sir. As soon as he gets his challenges resolved, he will be joining us. And slowly but steadily, we are creeping towards 125th mark of the online CME. Started way back in 2020. Online through YouTube Live, and now we are going YouTube, Facebook, and Instagram Live. I think Kalyani sir is in with us. Good evening, sir.
Good evening. Sorry for interruption.
Thank you, sir. We are now on the 121st mark of this CME, and we are back to basics with some sharing of clinical experiences. And with the permission of our President Kalyani sir, let us bring on today's inaugurator, a dynamic doctor and alumnus from NIH. Now recently joined NIH, his alma mater, as a creator of future alumni, as a teacher. Let's welcome, sir, with your permission.
Sure, grand good news for all of us.
Yeah, it's a proud moment to bring on screen just newly recruited, fresh teacher in NIH. He will be introducing himself, Dr. Aakash Deep. It's a proud moment for NIH Alumni Association, for all of us, that our alma mater, our student, is now a teacher to bring up new alumnus.
Right.
Welcome to
Thank you so much,
the online CME 121st edition. The stage is all yours, Dr. Aakash Deep.
Thank you so much, sir. Respected our president of NIH Alumni Association, Dr. Kalyani sir, our respected senior, Dr. Bidyut Mukherjee sir, and most importantly, our respected speaker for today, Dr. Jayati madam. I must tell you that all of you that being inaugurator for this program is a very big opportunity for me. All of you know me as a student of NIH. That is one of the greatest thing that I have that has ever happened to me after being in the field of homeopathy. And now again I have got the opportunity to be a teacher in NIH. That is also another blessing of God. I take it as a blessing of God. And thanks to NIH Alumni Association for giving me this platform. But I must apologize to the speaker for today, our senior madam, Dr. Jayati Pal madam. She is way more senior than me. She is an experienced clinician, a medical officer in the government of West Bengal. Being inaugurator for her program, I feel very sorry because I am very, very junior to you, ma'am. But still, as you have already comforted me that it is not about the senior junior, it's about all of as you have told already that it's all about soul. Please, with all of your blessings, I am very fortunate to inaugurate this online CME. I hope this online CME goes on because it is a platform for knowledge sharing where all the seniors and juniors can come together, and we can share our cases, we can share our theoretical knowledge, we can share the translation of theoretical knowledge to the practical field. We can definitely share amongst ourselves the experiences of research which is at present being performed in various fields of homeopathy. And then this all culminates into the growth of homeopathic fraternity as a overall. So I feel very fortunate to be the part of this journey, because this is the first time I have come to this platform. In spite of Bidyut sir repeatedly asking me, I was telling, sir, I am busy, because for last few years I was in Hyderabad, where I was also working as an assistant professor there. There, due to various works, I could not attend this online CME programs. We had night duties, we had patients there, a lot of patients are there, and still being a part of NIH, I am continuing to do that. I hope that over a period of time, all the fraternity comes together, and we are looking forward to our Golden Jubilee celebration in NIH. We hope that that will be a very grand reunion for all of us. Thank you, Bidyut sir. Thank you to Kalyani sir. Thank you to Jayati Pal madam. And thank you to Krittika madam for giving this opportunity to me for being the inaugurator for this program. And I welcome madam to the stage for sharing her experience, clinical journey with all of us. Thank you so much.
Thank you, Dr. Aakash Deep. Good evening, sir, Dr. Kalyani. Dr. Kalyani, sir, our President of NIH Alumni Association. Thank you, Dr. Bidyut. Thank you, Dr. Jayati. And good evening to all viewers today's CME. Thank you, Dr. Bidyut, for giving me opportunity to moderate this program. I am Dr. Krittika Biswas, 10th batch of DPNH, and I am DGM, retired DGM medical from NTPC. Today's speaker, Dr. Jayati Pal. I know her from 1990. She is my younger sister. So I am very happy to share this platform, same platform as a moderator. She is a speaker. She is a good clinical practitioner. She is a medical officer of government of West Bengal. Today's CME on the topic is my clinical experience. She will share her clinical practice from day-to-day practice. I hope all viewer and we all will be helpful from her practice clinical experience. So I over to Dr. Jayati Pal. Dr. Jayati, please start your lecture. Hello.
Hello. Hello.
Hello. Over to Jayati. Please start your lecture.
Hello. 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 Hello.
Yes, ma'am, we can hear you, ma'am. Ma'am,
Okay.
are you audible to us? We can hear you.
Yes. Om Shahana Bhavatu Shahano Bhunaktu Shahvirjam Karvavahai Tejasvi Navaditamastu Ma Vidvishavahai. Om Shanti. To my respected sir, Dr. Kalyani, should I say or sir or kaku? Because before coming to NIH as a student, I used to come to kaku for treatment. So for him, I have wrote the few lines I must read in Bengali. কি বলে ডাকিব জানি না আপনারে রাখিলাম রাখিলাম মমশি তব এই চরণে প্রভুর কাছে প্রার্থনা আপনার লাগি আনন্দে পূর্ণ সুস্থ জীবন দীর্ঘ জীবন মাগি সত্য নিষ্ঠা সহানুভূতি সদালাভ জীবন তব হাসি ভরা সৃজনশীল কর্মধারা পাথেয় হোক মম and next I convey my pranam and respect homage to all my teachers of NIH. By the immense help of such teachers, I am now a successful clinician. I convey my regards to my seniors, Bidyut, the Secretary of Alumni Association, and all the seniors. I convey my pranam. I convey my love and affection to my batchmates, my contemporaries, and love and affection for the juniors, brothers and sisters of homeopathy. Special thanks to Aakash Deep Das, Dr. Aakash Deep Das, Assistant Professor, Repertory NIH, for his nice introduction. And also I convey my pranam to Dr. Krittika Biswas Didi. When I came first time at NIH, she supported me just like motherly attitude. So today my topics, my clinical experience that was directed by Bidyut, and I am going to present few cases from my clinical practice. My Orgo, can you share? Okay. I, Dr. Jayati Pal, second batch of NIH. I did my undergraduate from NIH and MD from other institution. Since 2021, I am working as a medical officer under West Bengal government. And now, as a medical officer posted in Ghola SHD at Panihati State General Hospital. And another as a deputation, Rekjuani Rural Hospital. Today, my topics I am going to present before you. The 4 clinical cases I will discuss today. 2 cases are acute, one in autoimmune disease and another challenging varicose ulcer cases. My goal is to highlight homeopathic case management and evidence-based prescribing in diverse real-world scenario. First case, a patient, 42 years old male, come to me on 22nd July 2023, presented with this multiple red vesicular eruption, mild itching and pain on the right side of the back and abdomen, unable to lie in bed due to sensitive skin. With this complaint, he presented me on 26 July. The picture of back and front, I prescribed Rastux 30. Why prescription is here? Why I prescribe Rastux 30? There is a history on in this case. He took Calciacap 10 mg just 1 month back due to pain in multiple small joint and big joint because it was diagnosed as a rheumatoid arthritis, and that is evidenced by the blood report. He did the blood report 12 June 2023 with RA factor 160 international unit, anti-CCP more than 500 and uric acid 5.8 mg per dl. With this calculator cup 10m he came after 1 month for present complaint. And so I prescribed Rastux because there was no other symptoms. It was the month of July. He came to me. It was raining outside, vesicular eruption, without any modalities, under the coverage of calcarea curve. We know from the Gibson-Miller remedy relationship, the belladonna and Rastux is a complementary of calcarea. So straight away, without thinking anything, I prescribed Rastux 30, 8 doses for him. But after 2 days, এ যাচ্ছে না কেন গো, সরছে না কেন? শুনছো?
Hello, ma'am.
হ্যালো,
Ma'am,
শুনছো?
please use your ma'am. Please use your arrow button. Please use your
Hello?
arrow buttons. Please use your
After 2
arrow
days.
buttons, ma'am.
হ্যালো,
Ma'am, am I audible to you?
যেটা যাচ্ছে হচ্ছে না কেন, স্লাইড করছে না কেন? বন্ধ করেছি। এটা একটা একটা করে আসছে না, না একটা একটা করে আসছে, সব একসঙ্গে চলে আসছে। পুরোটা একসঙ্গে চলে আসছে, একটা একটা করে আসছে না। Arko, can you hear?
Yes, ma'am, I can. Ma'am, am I audible to you?
Yes, yes. The slide is coming,
Uh,
all the slides coming at a time, but I have presented the one by one. It is not presenting here.
like this, though. This is the process, ma'am. Slide 5.
No.
After slide 4, then slide 5.
In every slide, the components should become one after another. In each slide, the
by
components
clicking
become,
over that. That's
yes.
That's of
That is not
the
possible.
power present day. That is a PowerPoint thing. That is not possible here. It completely come up with that presentation only. In that PowerPoint process, slideshow process, it happens, but in StreamYard, it's not possible. It's completely on this format only. You have to just change the slide only.
Okay. Then I am continuing. Okay.
Yes, ma'am.
So after 2 days, after giving Rastux to 30 for the patient, after 2 days, on 25th July, he presented with this picture. The eruption further increased in the abdomen and back. Burning pain and itching also increased, but scratching causes burning, and all the complaint aggravated at night. And due to this pain and sensitivity of the skin, patient is unable to lie on that side. Even she could not sleep for last few days. Though the patient is chilly, but remain uncovered due to his sensitivity. With this, he came on 25th July. So from this picture, these vesicular eruption, papules, on erythematous base, segmental distribution of pain on the right side of the back and abdomen with the history of chicken pox, it is very clear to us the patient is suffering from herpes zoster or shingles. And the cause we all know, it is caused by varicella zoster virus. After an attack of chicken pox, the virus remains dormant in the sensory root ganglion, and this case is herpes zoster. Now, from the case, I usually in my practice, I mostly consult Kent Repertory, Boric Medica, Boric Repertory. But in this case, the NAR Repertory helped me to select the medicine. Because NAR Repertory, why I choose? Because NAR Repertory is a Puritan type of repertory. It is based on heading guiding symptoms. The drug are less in number against of each rubric, and these drugs are very proved and verified. So I consulted NAR Repertory for this case, and I am showing the picture. If we go the skin chapter of NAR Repertory, eruption, herpes, itching and burning, there is 2 drugs, arsenic, sorinum. If we consult skin chapter, NAR Repertory, herpes zoster across the right side of the abdomen, which was the presented symptoms of my case, covered by mercury. If I consult only burning in NAR Repertory, 2 drugs, graphitis, meserium. If I consult whole herpes zoster rubric in general, there are so many drugs, but meserium and ranunculus barbosus is the first grade. So first grade means double thick band, most important. So the next slide. Here, my case was the 4 component. 1, vesicular eruption. Second is the neuralgic pain, burning pain. Third is itching. And fourth is the sensitivity of the skin. And these 4 components covered in skin chapter of Kent Repertory: eruption, herpes zoster with severe neuralgic pain, itching after scratching, turn into burning, worse in bed, from touch. Only medicine is meserium. And it was the damn day. We all know from our knowledge of Medica, meserium is a chilly patient. It aggravates in the damn cold. So all are favors to the meserium. So from here I have written a differentiating drug of ranunculus bulbosus because both are the first grade drug in the NAR Repertory. But in ranunculus, what we will get? The special distribution of the symptoms, the location, the supraorbital region and the intercostal region is the locationally much more covered by the ranunculus bulbosus. And the stitching type of pain is the ranunculus bulbosus, where both the symptoms was not present in my case. So it is clear to us why I have given the meserium. Meserium 1m was given 4 doses, 4 globules in 60 ml of distilled water. Usually I mix the pellets in distilled water, giving 10 stroke. It makes the alter potency, and by this way I give. Due to the strength of infection, this is my clinical experience, you may say, I started with 1m potency, and I also advise you omit the medicine as soon as you feel better. And medicine was taken every 8 hours interval. And if requires, you may take 4 doses. But after every 1 dose, you wait for 8 hours. Observe, is there any improvement? If you feel the improvement, you don't take the next dose. And he took the 3 doses because he was able to lie down after taking 3 days, taking 3 doses, and he slept after 3 days properly. Is a picture of 25th July 2023. She could not come to me, so it is my mobile phone captured. I have showing through telephone. I have WhatsApp. I have prescribed this medicine. 22nd July, you see, there is congestion in front and back. Still the infection is going on, front and back view. But here, 28 July, after taking medicine 25th and 26th morning, the back 28th, the crust formation started. And here, the inflammatory condition is much more less and crust is also prominent. And 30th means after 5 days, almost 5 days of starting medicine. 25th he started and it is 5 or 6 days. You see the massive crust formation. And if we read the Boric Materia Medica, Meserium chapter, then we will see the herpes zoster, the vesicular eruption and the eczema, both are intermingled. It is very difficult to differentiate the symptoms covered by the herpes and symptoms covered for the eczema. So, I consulted Boric, but here Dr. Nar, Repertory, helped me a lot to clear out the case. On 10th August, he sent the picture, he came, there are no more medicine, only he has taken the medicine 25th July, 2 doses, and 26th morning, 1. On 28th August, he came because he is my previous patient. He was already under calcarea carb 10M, and 1 dose again prescribed for his neurofibroma, depending on the totality of symptoms. And after 1 year, almost 1 year, 15 July 2024, he came to me, not for his complaint. He attended OPD for his family members. Till date, the neurofibroma is less and no more joint pain till 15 July 2024. And patient is perfectly well. My second case. It is my second case, the female lady, very good looking, fair, 29 years old, presented to me on 8th February 2025. Weight gain, puffiness face, unable to digest food, with poor appetite, weakness with disturbed sleep, anxiety about her condition, irritability with sudden outburst of anger, and mood swing. These are the present complaint presented by the patient, but there is a history. This complaint developed on a history. That is very significant to this case. Patient was hospitalized. She came to me February 8th, but first time he hospitalized November 26th with oral wet purpura. Wet purpura means the purpura on the mucous surface. It appears on the oral mouth, tongue, posterior surface of the pharynx, even in the intestine. Presented with oral purpura and skin purpura with platelet 5000 per cubic millimeter. He treated IV methylprednisolone IM 1 milligram for 3 consecutive days. Platelet increase 2.5 lakhs within 4 days. And she discharged from the hospital with oral prednisolone on tapering dose from 50 grams to 10 grams, which was taken next 6 weeks. All the document is written here by the attending physician as a case summary. But I, for the time, for not for reading these things, for lack of time, just I am presented for easy understanding the case. So after 6 weeks, patient again decreases the platelet count. All the documents is with me, but so much bunch, I could not get any time to enter such reports because in every case I have to omit the name, laboratory headings, everything. I could not able to get the time to do that conversion work. So after 6 weeks, when platelet again decreased, they added another drug, L-Trombopac 50 mg OD for 5 days, which was increased the platelet count 5.6 lakhs on 9th January 2025. And again they tapered down the doses. On 25th January 2025, means from 9th to 25th, only 15 days, patient was better. But after 25th, again presented with wet purpura, this time not only with wet purpura, not only the purpuric spot in the lower abdomen, but she started gum bleeding. And with platelet count 8,000 per cubic millimeter. 26th November, it was started. Now it is 25th January. Almost 2 months she took the medicine. They have that tried level based. First line of defense, IV methylpenicillin, oral penicillin, along with the medicine which increase the platelet, L-Trombopac. Not only that, this L-Trombopac has an immense side effect on liver and kidney. In spite of that, after 2 days of treatment, when she again admitted to the hospital, they have started IV methylpenicillin 50 mg along with L-Trombopac. Both the drug started together because of the poor outcome of the patient. And this time, after getting 4 days of such treatment, platelet raised 1.3 lakhs. Previously, only with methylpenicillin, after 4 days, the platelet was 2.5 lakhs. But this time, with simultaneously both the medicine, only it increases 1.3 lakhs. They discharge the patient on 31st January 2025, but with a alarming counseling to the patient relative about the poor responding nature of the disease. What they told? We are trying our level best, but the patient is not well responding to our medicine. These things is very pitiful situation for the patient, and all are written here. Patient relatives have been counseled regarding poor responding nature of disease. It is written by the attending doctor. So this case is, they have diagnosed this case. After diagnosis, they have came to me. They diagnosed the case as a newly diagnosed immune thrombocytopenia. Previously, it was known to us idiopathic thrombocytopenia. Now, they have the new nomenclature, new classification. You see the classification of immune thrombocytopenia. If we see the pink block in middle, newly diagnosed ITP. Why it is newly diagnosed? Because according to the duration of the disease, they have classified such way. If it is 0 to 3 months, so newly diagnosed. Their mode of treatment, steroid and MGV. If it is 3 to 12 months, mode of treatment is different. If it's more than 12 months, and the mode of treatment is much more vigorous, and ultimately you see the splenectomy. So, after suffering started from the 26th November, she came to me 2nd February. Already it is near about 3 months, not crossed. here, what should be the motto of a clinician? We must cut short the disease process. Otherwise, the danger may come. So, our motto is cut short the disease process. So, as a homeopath, we took the case properly. There is a history of PCOS because she is my old patient. I treated her for PCOD 10 years back with homeopathy medicine, and till date she is better. Everything is regularized on that part. 3 to 4 months back, for the skin lesion, she consulted dermatologist and she took some medicine, applied some ointment. Family history, mother colloidal nodule goiter. Personal history, she is in service now, no addiction, service has the stress because private office has a great stress, no addiction. She is trying to maintain the healthy lifestyle since the treatment of PCOS. Homeopathic observation, sunlight intolerance, patient is warm-bodied, appetite decreased, but patient only had a strong desire for bitter food. Desire onion, meat, fish. Thus 2 to 3 liters per day. Bile habit regular but hard stool. Perspiration easy. Sleep disturbs. She expressed that she talks to dead people, not as a dream. Brooding on past event, always talking about her change in figure and face, causing sadness as family members arrange for her marriage. Always wants to be alone, and on examination, oily face and dark circle around the eyes. From this case taking, it is only written here, but the expression, I bold the 3 lines here. Strong desire bitter that haunt me. She is not able to take the food, but only bitter things she can take. And second part, sleep. During sleep, he is talking with his dead grandmother, grandfather, uncle. This is also haunt me to think something else as a clinician. And brooding. And third point is very significant. From childhood, I am seeing last 10-15 years, I am seeing her. Really, she is looking very good. Sober, soft looking, very good. Nowadays, only she is seeing the image through mirror, and she, even after morning, after waking up, she's looking, when she's looking the mirror, she is very sad. Repeatedly saying, Auntie, I'm not feeling good. I'm so sad. Why my face is like that? Why I change my face? Why my face is changed? My figure is changed. I was so. You have seen me long time. You see, I told nothing happened. It is for the medicine. No problem. It will be all right. No. I'm very sad. My parents are arranging for marriage, and you see what is my condition. Repeatedly, she is emphasizing these symptoms, and that haunt my mind during case taking. And that thing I also haunt in one drug, haunt my mind. And I'll show you the repertory what I consulted. Here I took the Kent repertory. Kent repertory desire bitter 2 drug, Netramute digitalis. If you consult mind chapter, Kent repertory talks to himself, dream with dead people with. Then there are so many drugs. Calcarea silicata, hyoscyamus, belladonna, cantharis, helonias, netramure, and stramonium. And if we consider the mind, delusion, imagination, hallucination, illusion, Richard thinks he looks while looking in a mirror. And that rubric really repeatedly I remembered that rubric. When she is speaking, that rubric was haunted in my mind. So I'm showing the rubric. Now, straight away, it could not take any time to decide to take the decision to come to Netremure for me. Presenting symptoms is really supporting to Netremure. So, but puffiness of face, gaining weight, tiredness, disturbed sleep, recent indigestion, mood swing, all are probably the effect of methylprednisolone. Because we all know methylprednisolone typically prescribed when an anti-inflammatory and immunosuppressive activity in the human being. And the common side effects are, what are the common side effects is presented at present by the patient. So first I thought I must give a tautopathic medicine and followed by a constitutional drug. Because from the knowledge of literature, if we consult literature, what is tautopathy? Written by Dr. R.P. Patel. Here we see, if we see, the tautopathy is the method of curing or removing the bad effect of the drug. And again, he wrote, it remove some obstacle to recovery in each case. So, being the thoughts that her present complaint is just effect of the methylprednisolone. So first, I must start with the tautopathic drug and then the constitutional drug. So our constitutional drug will act more suitably. So on 8th February, I started prednisolone 30 BD 8 dose. After 7 days, Netremure 0/4 twice daily for 8 days. Then Netremure 0/6 OD 16 days. I started with 0/4, not 0/1, 2, 3. And after 1 month of treatment, near about 1 month, 13th March, she came. And with no history of bleeding, no history of platelet come down, no other complaint, facial expression change, feeling better, appetite better, anger less, with good sleep. I again prescribe prednisolone 30 because still they are taking the allopathic prednisolone. I counsel them, you may stop, but I do not force them. Because in my practice, I have seen I should not force the patient. Our medicine helps such a way the allopathic doctors automatically taper down their dose. If the patient is better, they will not give the medicine. So, as she is taking prednisolone, still I repeat the prednisolone 30 BD 8 dose, and after 7 days again Netremure 0/8. Then I do not give any prednisolone because patient is really far better. Netremure 0/9, 0/10 continues for 1 month. Then 23rd May came Netremure 0/12, 0/14, and last week 23rd July the platelet count 1.8 and patient is hemodynamically stable and mentally stable. Our aim was on February, March, April, May, June, July. Only five months passed away. Our aim was not to repeat, not to deteriorate. The newly diagnosed case should not proceed the persistent ITP as a persistent ITP. And that challenge was successfully treated by homeopathic medicine. My next case, the old patient, aged 72 years. She complained on July 29, 2021. Severe burning pain of non-healing ulceration of her right leg for the last 1 year. Oozing, you can see the oozing severely from large ulcerated area, indigestion, distension of abdomen after eating, not relieved by eructation, food comes out with the eructation, diminished appetite and taste of food, intermittent pain, right side of the head with acidity and constipation. These are the presenting symptoms. And this patient has got a good history. What is the past history? Patient is suffering from last 1 year. Small ulcer first came in the right side of the leg, and by conservative treatment and wound care that disappear. Again same thing, repeat for two times in the same leg, and every time treated by conservative treatment with some antibiotics, ointment and proper wound care, and it disappear. But last 8 months, in spite of all measure, the ulceration has not improved and developed the present situation. They are puzzled. Every day, dresser is coming, dressing, and immense fluid is coming out, so that the dressing is wetted, and next day again doing dressing. This is going on last 8 months. Patient is puzzled with this complaint. There is a past history of ovarian cancer. The same patient operated and chemotherapy completed, and patient is stable since then. 2010, there was a history of hernia on that operated site, reconstructed. And at that time, she has the varicose vein and laser surgery was done. 2010. Family history, nothing significant, only hypertension. Personal history, widow, she has only one daughter, no addiction, no case of hypertension, non-diabetic, mostly non-ambulatory due to this condition. Homeopathic observation, which is very important because of the prescription. We must sincerely observe the patient from every corner. Chilly patient, appetite diminished, not getting proper taste of food, desire sweet, warm food, drinks, thirst moderate, bowel movement, not passing sufficient amount of stool, sleep disturbs, dream full of anxiety and frightful dreams. During observation, 3 things came prominently, and that 3 things I wrote. First, she prefers company as she was non-ambulatory condition for a few months and remain alone. So always she over telephone, she calls her daughter, talks with her, and repeatedly he told he is not feeling good as she is alone. She needs company. Secondly, during the conversation, it is revealed to me that being a senior of the family, she could not decide their family property matter and her own treatment purpose also. Because of this suffering, he is puzzled. Patient is so dominating, he could not take the advice of others. Her daughter-in-law is repeatedly requesting for the homeopathic advice, but he is indecisive. He cannot take any decision, cannot take any decision what to do. And on observation, third point, during narrating her symptoms, her attitude was domineering in character, because many times she was not allowing her daughter to interfere for expressing the life situation of the patient. কি চলছে সেটা এক্সপ্রেস করার জন্য মেয়ে যতবার কিছু বলবার চেষ্টা করছে থামিয়ে দিচ্ছে, আমি বলছি তুই থাম, আমি ঠিক বলবো। This was her attitude. And being a senior, always domineering, but nowadays he could not take the decision. This was the prominent mental symptoms in this case. I repertorized the case through Kent Repertory. Mind company, because this company desire alone while aggravation. This was his will. I took the will first. Second, irresolution in act and dictatorial. These two rubric is the understanding part. So next I took, and followed by the physical symptoms, desire, warm food, woundings, wound slow to heal, sleep interrupted, constipation. I have taken the rubric constipation, sedentary habits from, because long time she is non-ambulatory, and ulcer, leg burning. All the rubric through addition method, it reveals that covering 10 symptoms, 17 lycopodia. So this repertorization helped me to select the remedy. So my plan was, she came to me on 29th July. My plan was to give LM potency. But the literature from homeopathic materia medica, always we know that we should not start chronic cases with Lycopodium clavatum. But here the picture was clear cut. So I started with Lycopodium, LM potency. I don't want to waste the time. For 16 days, I have given. After 16 days, I prescribe gunpowder 3x. That is also from the knowledge of materia medica by J.H. Clark, written in the gunpowder chapter. Next slide coming. And with the advice, with this prescription, I advise dressing should be every alternate day. If required heavy wetness, then you may do the subsequent days. Otherwise, if patient feels better, no need of everyday dressing. Let them heal up. This gunpowder chapter, J.H. Clark. The indication for this remedy are broad and clear, so that no fine differentiation of the symptoms is required. There is no proving of gunpowder, but I made an experiment on myself with the 2x, as I have mentioned in my article on Calinitricum in my Dictionary of Materia Medica. I have used almost exclusively the 3x titration, which I have prescribed in 4th, 6th, and 8th grain doses 3 to 4 times per day, either in the form of powder or tablet. I have found, he wrote, I have not found it disagree with any other remedy, so that there need not be no fear of alternating it with some other remedy if particularly indicated. In my case, so I do not have any fear, no problem, because he guided me nicely in the literature. So I gave Lycopodium first for 16 days, then for 15 days gunpowder 3x. And after next 14th August, they sent a picture to me. Beat change, and the oozing still present. Then 24th August, first follow-up came. Burning pain less than before. Aggressive look of the ulcer have already changed. Oozing less than before. Appetite bit improved. Distension abdomen also less than before. Interrupted sleep also improved. As a whole, patient feels better. So this time, I advise them dressing by a qualified dresser twice in a week, and affected area should remain for long time, and only apply virgin coconut oil. I prescribe lycopodium 0/4 and followed by gunpowder again for 15 days. Next follow-up, pain and burning again severely increased with the exfoliation of the skin. Due to increased burning and pain, she is very much anxious and fearful because her daughter-in-law and daughter came the patient to me. She do not came before previously. She do not take the homeopathic medicine. So she is anxious again for burning pain. She is fearful. What will happen? Again all the burning is coming. What to do? And there she is disturbing them, daughter and daughter-in-law. What to do next? And in this meantime, she is extremely depressed and dissatisfied about the family's issues and along with the varicose ulcer trap leg. Both the things disturb him, burning aggravated and family issue. And she became impatient and restless. And her expression of anxiety is really guiding me to think further. Again, I did the repertorized. Now, in mind, I take discontented, displeased, and dissatisfied rubric with everything. Next, I took impatience. Next, I took anxiety, fear with all the, and next, irresolute acting. All other rubric as previously taken as before. This time, lycopodium again came first, and second is arsenic, third is sulfur. From my clinical knowledge, it is clear to me during conversation, patient soric stage is dominating now. So, and after lycopodium, the next medicine should be sulfur. These two is from the knowledge of Mathematica, Organon, and experience of my previous life. I started brimstone for this case. One prescription is missing here. I started brimstone. I started brimstone 0/4 and 0/6 for this case. And after taking brimstone 0/4 and 0/6, patient next follow-up came. Burning pain remarkably improved. Previously, she came 29th September. Next, she came November 25th. And previously, with this situation, I prescribed the brimstone 0/4 and 0/6. 0/4 for 16 days and 0/6 for 16 days. And now, after almost 2 months, she presented burning pain remarkably improved, less than before. But the sensitivity, soreness of the affected area very acutely present. Aggressive look of the ulcer further improved, we can see. Now there is no oozing, stopped all oozing. Appetite further improved. Interruption sleep is also better. Patient as a whole improved. We can see that previously it was in the upward direction, all the inflammation. Now it is going down following the Hering's law. That is another indication of improvement. And this time I advise stop dressing because from my experience it is causing injury. So I stop the dressing, only apply coconut oil. Means From last 3 months, she was under dressing. After 3 months, I stopped the dressing. And gradually lesion is improving from upper part of leg. And this time, for the soreness of the leg, I prescribed Leopard's Bean 208 doses in 60 ml of distilled water, BD 1 day every 5th day. This knowledge I gathered from literature, and also I have seen. I give the medicine to the patient and tell, please wait for 4 days, 5 days, in case 7 days, 8 days. If there is no improvement, take another dose. By this way, I instructed this patient also. Take morning, evening 1 dose, wait for 5 days. If soreness reduce, pain reduce, improvement is there, don't take further dose. But here patient took all the 8 doses every 5th day interval. This is the antipsoric chronic disease written by Dr. Hahnemann. Here is written, in chronic disease, we have found it is best to give doses, spoonful of a solution of a suitable medicine at least every 2 days. More usually every day. Here I used 5 days interval. And almost after 3 months, patient came to my home first time by walking. This is the 4th follow-up, January 16, 2022. Brimstone 200, 1M and 10M, 1 dose each, consecutively 3 days was prescribed based on totality of symptoms and ended with antipsoric. And no more medicine is required for this case. So, it is clear to us, a surgical case can be tackled by homeopathic medicine, provided the observation should be sound. My 4th case and last case, a male patient, 63 years old, on 4th March 2024, presented with the high rise of temperature with profound drowsiness and was unable to open his eyes for last 2 days. He has taken paracetamol for 2 days, 2nd and 3rd March, without any sufficient relief. No improvement of drowsiness, only fever subsided, no improvement of heaviness eyes, and there was a history of exposure to sun heat the day before fever started, and patient was complete thirstless. And these 3 cardinal symptoms is lead me to prescribe Gelsemium. Patient is thirstless, history of exposure to sun heat, and patient heaviness head, patient is drowsy, unable to open the eye. Gelsemium 200 was prescribed from the knowledge of Materia Medica, 4 doses, 2 hoursly given and advised, because he came to me 4th March, but he is suffering 1st March from the fever. He is suffering from the 1st March. Already 4th March, 4th day, passed away. So I advise him, please do a blood report. CBC and CRP was done. On 5th March, blood report was done. CRP 176. WBC 15,200. Neutrophil 75%. ESR 80 milligram per hour. And fasting blood sugar 99. So from this blood picture, it is clear to us patient is suffering from an acute infection anywhere on the body with this fever. And patient presented on 5th March with this swelling, fiery red swelling over the right face with constrictive sensation and sensitive to touch. Still fever continuing, but less in intensity. Drowsiness still persisting, but less than before. Discomfort of face only relieved by cold water application. So, history of exposure to sun, drowsiness, it was previously. Thirstlessness still persisting. And from present complaint, it is clear to me the patient requires epismel. I do not consult any repertory. From the knowledge of materia medica and my regular practice, I straightway prescribe epismel 200, 4 dose, 2 hourly 4 times for 6 months, and for 7 months 1 m, 2 doses 8 hourly. This was my prescription. Because of the increased CRP 176 was alarming to me. The cellulitis over the cheek, over the face, we know. If anything, we cannot control the progress of the disease. That cellulitis may go to the brain through cavernous sinus. This is a dangerous zone, face, that we know. So, I have to select a potency. I have to select the medicine. We just immediately give change to the patient. They will not give them much time. So, straight away I prescribe 2 hourly 4 doses 200 and 1 m 2 doses to arrest the progress of the disease. Next, 6 March, swelling still present. 7th March, it is mild, improve. 8 March, there is better than before. 10 March, CRP came down to, again report done, CRP came down to 12.7 and WBC 10,600, neutrophil 60%. All in inflammatory marking are coming down. And in 11th March, only I have prescribed placebo for the 15 days. He is also my old patient. He was tongue cancer, operated many years back, and following that, he never took allopathy medicine. Last 10-15 years, he is, for different reason, under homeopathic medicine. So, in this virulent condition, he also attended me. He did not went to other doctor. And on 28th, for his regular visit, he came with the CRP 1.2. Previously, ESR was not come down. If we see here, the ESR was still, it is 80. First visit it was 80, and second also it was 80, not coming down. But I waited 15 days. After 15 days, the ESR came down to 17 mm per hour with normal neutrophil, normal WBC count, and CRP normal. So, I finished my 4 cases today. 4 diverse cases successfully treated using individualized homeopathy. Each case is discussed in depth from the homeopathic perspective. The formal case report formula as per home case care guideline is not strictly followed here. This deviation is due to the detailed, vivid discussion format specific to these cases rather than standardized reporting. And emphasis on the clinical reason, remedy selection, and patient response rather than the structured protocol. I have given emphasis on the clinical reasoning much more than the standard protocol. So, what is the take-home message? Individualization is the key. Holistic approach is the key. Case documentation is also very important, and replicability and viability is also important. Patient centered care. That lady, for their face, I must take care. The old female with this huge leg ulcer, I must take care. And complementary role, homeopathy often complete conventional treatment, providing holistic and individualized support to chronic and acute condition that I have shown here. And lastly, what as a learner I am doing? Learning, that is the continuous learning process. Regular reading of authentic materia medica. For juniors, I suggest read every day Nash, E.B. Nash and N.M. Chaudhary, Alan Borick. And regular repertory consultation, regular upgradation of knowledge of practice of medicine, regular participation in the CME and clinical discussion is vital for refining prescription skill, staying updated with new insight in homeopathic practice. So, thank you all. According to Swami Vivekananda, who is helping you, don't forget them. Here, patients are helping us. We should not forget the patient. Who is loving you, don't hate them. They are also love me. Who is believing you, don't cheat them. Patient also believe us. So, I must take care of every nooks and corner of a patient. Previously, it was, we know, in our time, physicians is a family physician. Now, that family physician concept had changed. But we should be a homeopath, should be a family advisor, family physician. Thank you to all of you. I convey my pranam to all my teachers. Especially, I learned basic deep acting homeopathic medicine from Dr. Somendu Vikas, from Dr. Somendu Adhikari sir. But during the course of my practice, I learned this knowledge of few drugs is not sufficient to tackle all the cases. So I learned from Dr. Sunirmal Sarkar sir. Still I am going. I am attaching myself with her for learning how to tackle more aggressive disease, more incurable disease. Actually, from sir, it is clear to me, if symptoms collaborate, there is no question of incurable disease. It is the eyes of homeopathic physician. It is the mind and knowledge of homeopathic medicine can combat any of the complaint. So, here my sincere regards to all my teacher. I finished my today's presentation. Thank you to all of you, all the viewers, all my friends, sisters and brothers of homeopathy. Thank you all. Sarve bhavantu sukhinaha, sarve shantu niramaya, sarve bhadrani pasyantu, ma kaschit dukhabhag bhavet. Om Shanti Shanti Shanti.
Hello.
Hello. শুনতে পাচ্ছি? কৃত্তিকা দি আমি শুনতে পাচ্ছি।
আচ্ছা আচ্ছা, okay. Thank you, Jayati, for nice presentation. Your all cases are very nice. Briefly explain with documentation and your way of case taking, way of repertorization and selection of potency, selection of medicine was very nice. I think we all
থ্যাংক ইউ দিদি।
learn from here. I want to say one thing. It is your first case was herpes zoster. We all know the herpes zoster is a viral infection. Very painful rash appears on strip of beetles in skin. Pain can persist even after the rash is gone. But our homeopathic medicine is very effective in herpes zoster, because I was work on allopathic hospital. I was homeopathic medical officer, but hospital was allopathic. So few patient came to me. They took allopathic medicine for herpes zoster, but after cure of rash, they persist pain. But when I applied homeopathic medicine, when I gave homeopathic medicine, they are completely cured. So your case was very nice. And second case was ITP, immunothrombocytopenia. It is a idiopathic thrombocytopenic purpura. There is small purplish spots over the skin, bleeding and bruising, and prolonged period of nosebleed. Your case was your prescription was Natramur. This case also your selection was very good according to your symptom and your clinical proofs, and your selection of potency was very good, and you cured case this. Third case was varicose ulcer. Varicose ulcer also a typical ulcer over the ankle caused by poor circulation and abnormal vein function. Here also your prescription was lycopodium, and according to your case history, symptom goes to as lycopodium, and patient was cured by lycopodium. It was also very nice. And cellulitis on face. Cellulitis is a bacterial skin infection that causes redness, swelling, and pain in the affected area. And this case was also very nice, and you cured is a surgical case, an acute case by homeopathic medicine. So nice of you, Jayati.
Last case, it is there is no pain, burning, stinging, nothing was there. Only there was constrictive sensation. That astonished me. Should I prescribe ABC or not? But the other symptoms, read me, thirstlessness, right side, fiery redness, restlessness. Then I straight away
Last case potency কত ছিল patient?
200. I have given CRP high, so I have started 200 2 hourly 4 times. Then 1 m 8 hours
200
interval.
200
2
which
hourly
medicine?
4 times. 2 hourly 4 times. 2 hourly 4 times. 200 2 hourly 4 times.
Medicine was
Epismel, and second day 1 m 12 hour interval. Due to the depth of infection, CRP high, so to come back with this situation, I use this potency. There was no pain. I thought whether should I prescribe, but the constrictive sensation. Patient is telling this is drawing sensation, so not covering. Epis has just constrictive sensation, but no, there was no stinging pain. of APs. That is also very much, I am very much happy after seeing the result. This constrictive pain of APs is so dominant in clinically. This gave me a pleasure.
Yes, your case presentation was very nice. Keep it up, Jayati.
Thank you, Didi. Bless
Okay.
me. Bless me.
Nothing to say more. Okay, thank you all.
Thank you.
Thank you to Dr. Bidyut. Over to Dr. Bidyut. Any question? Any question from audience?
Yeah, there is one question about Saurabh Ghosh from Facebook Live. Jayati, this question is on the screen.
Ha, madam, I have polyp in my gallbladder, 4.2 mm, cyst in my prostate. Is it possible to vanish through homeopathy? Please give me answer. And where will I go? Any contact? Really? Both the complaint? If symptoms collaborate, no problem. It may go. Because you have a tendency, cyst in the prostate and polyp in the, you have a tendency to develop a growth. You may contact any good observer, good homeopath in your surroundings of your residence. A sincere homeopath can remove this both the two.
Thank you, Dr. Jayati. It has been an excellent presentation. Now, I'll request who inspired you to join NIH, your uncle, your sir, our beloved President, Dr. Debnaran Kalyani, sir, to shower your blessings with your observations.
Thank you, Dr. Mukherjee. Many, many thanks to all of you on screen and out of screen, those who are observing. Beautiful seminar today. Beautiful. Now, regarding Aakash Deep Das, Dr. Aakash Deep Das, we are very proud because he has become one, alumni has become alumni maker. We are very, very proud and expecting many things from him in near future and in a very important department, Repertory. Many thanks for his nice inauguration. And our sister Krittika, Dr. Krittika Biswas is always very close to us. Very, very beautiful lady. One of the best possible sister I can tell you. My daughter's experience is Krittika ma'am is more a mother than a doctor. For a few days he was with her.
Hello.
And that same thing I have started about Krittika ji. When I came to NIH, she was a replacement of my mother.
And reply was better a mother than doctor. We are really proud.
Thank you, sir. Thank you.
And next question is regarding Jayati. Fantastic. He's all along very sincere, very meticulous, never leaves anything casually. So that's why we are very lucky to get him today because he has become sticky to be before us in a seminar. I think from today onwards, he has become free to be with us in seminar as a speaker. And definitely he's having many more information, many more good cases. He will present in near future. We are welcoming him. The fantastic thing in his speech is what I have loved maximum. That is his takeaway message. It was beautiful for all of us. If we are serious on the takeaway message, all of us will be successful. If in 4 cases, only 1 case, if we be very sincere, serious, a tremendous historical change can come to us. See, most of the scholars, stalwarts, many of them starting from morning question. Simply by seeing one cure by homeopathy, change his entire profession, entire life. There are many more in entire world, many brilliant persons in their profession simply by seeing improvement of only 1 case. So 1 case is not a casual thing. single case can change one or many lives. Moreover, our homeopathic, mathematical homeopathic system, till now, it is full of clinical experiences. Now, recently we are shouting at Dr. Jayati Pal presented documentation. We are shouting for documentation, not for homeopathy, obviously for our further confidence, but to cope with the conventional system of medicines, to give proper scientific reply to the critics who are, without knowing homeopathy in details, are criticizing homeopathy as a placebo effect. And this placebo effect cry is not from now, from many, many years back. Once they find an improvement, placebo effect. So now we are gradually able to show them that your talks are placebo. Come
Yes.
to NIH, come to the alumni, see the case report, certified by your specialist, hematologist or radiologist or sonologist, change your opinion by seeing the improvement of alumni of NIH and alumni hospital, your NIH hospital. So it is our request to all of you to present yourself as Dr. Pal presented, very critically, scientifically. Presentation was beautiful, avoiding all legal sides. This also to be learned, how to present cases. So anyway, and all the cases are very brilliant, definitely. Homeopathy is called to be a treatment of rejected cases. Previously it was called that those boys have nothing to do, they come to homeopathy to study. But these are proving that the patient has nothing to do. The doctors have nothing to do. They are bound to come to homeopathy for cures. Day by day, the number of doctors are increasing. Moreover, day by day, homeopathic follower, the patients are increasing much more than the doctors. That means the system, the government, the academic institutions, they are flourishing obviously. But the flourishment of successful cures of the patients are so much that government institutions they are being, I should not say compelled, they have become interested to improve the system by giving huge funds, infrastructures, appointments, services, etc. So all these achievements what we have got today, it is simply for cures of different incurable cases, not because somebody has given fund or assisted. Homeopathy is proceeding, homeopathy is progressing. Homeopathy is proceeding simply by the cures. One after another, we are curing patient. One patient cure does not mean one case. One patient cure means the whole family is being convinced that yes, homeopathy can do it, while others fail. By seeing the patient relatives, his social person, companions, everybody become confident that yes, homeopathy can do miracles, can cure such type of diffuse cases. So one case does not mean only one case. One case means a number of people are convinced by homeopathy. That is our challenge we are doing. We will go on doing, present these documents, and we will present before us because every one of us want to learn every day, as Jayati was telling that learning is a continuous process. Once we stop learning, means we are dead. So every moment, every day, from every case, from everybody, we should learn, by which our confidence will increase, our experience will increase, we will be more successful in other cases. See, by seeing one case, what happens, I will tell you one incident. So one day, you might have heard the name of Dr. P.C. Pal in Calcutta Homeopathic Medical College. After completion of the course, when we are house staff before coming to NIT, one day I asked him, sir, I want to go to your chamber to learn something. Now, for light in homeopathy, further light in homeopathy. He became very angry immediately on the corridor. He told, you needed to go to my chamber. Now you want to go to Dr. S.R. Chatterjee's chamber. At that time, Professor S.R. Chatterjee was a brilliant practitioner and fees were more, number of patients, huge income. He told, now you go to him, learn how to earn. If you have not learned anything by these 4 years, by seeing cure cases, you will never learn homeopathy. So this was his reply. That means once we see cases improving in our hospital, in our practice, automatically confidence aggravates. Automatically zeal or desire to study, to find out with the research mentality automatically comes by seeing the success of others and our own. So brothers and sisters, to all, it is our request that please send your cases, inspire us, be inspired by our inspirations, and we should all together proceed for more and more development of homeopathy. The more we will be able to show the people's cured cases, the more we are progressing. There is no power in the universe who can stop progress of homeopathy if we go on presenting the cases. You might be knowing that for many years, homeopathy was tortured like anything. Hahnemann had to leave country after country. He was chased, not allowed to practice. This was the torture. But Audi Separe, he never bowed down his head before untruths. So that's why we should remember this animal Audi Separe. We will come forward with our cured cases to strengthen ourselves. The rest will automatically come. If we go on curing cases, government will give more and more services. If we go on curing number of cases, more and more fund will be given to the hospitals. More college will be open. More people should be interested to study. More parents should be interested to send their children. So this way, or this is the only way to progress, to develop homeopathy, simply by curing cases than any other means. So thank you very much. Many things we have learned from Jayati, especially the sincerity and steppings of treating cases. Many thanks.
Thank you, sir.
Here again, and request to all of you, please come forward. Even if you are having one case, show us. Thank you. Bidyut, please.
Yes, sir. Pranam.
Thank you so much, sir. And we have few announcements to make. First of all, we are really proud to announce again and again that this year we are going to celebrate the 50th anniversary of our beloved alma mater, National Institute of Homeopathy. And the date of the alumni meet will be on 12th of December. So the alumnus across the globe, whoever is watching the show, since last few episodes we have been saying, do book your date on 12th of December. There will be program also on 10th and 11th from the Office of the Director National Institute of Homeopathy. That will be informed in due course. But from the NIH Alumni Association, the program will be on 12th of December. So do book your tickets, book your plan, and the detail of individual meetings, separate Zoom meetings are being held every 14 days. And we are repeatedly requesting all the alumnus across the globe do connect each other and be there on 12th of December. Now, there is another very interesting thing to announce. On 2022, we had started with Exemplary Contribution Award in Homeopathy for the alumnus of National Institute of Homeopathy. It was the first time where we had formed a committee headed by Dr. Ishwara Das sir and several other respected members. This committee had selected one each from DPNIH, from BHMS, and from MD course. This year also, we are going to have another episode of Exemplary Contribution in Homeopathy Award for the alumnus of NIH, from DPNIH, from BHMS, and from MD. I'll request our IT consultant, Dr. Orko Mukherjee, to add the scanner and the link of the submission of the this exemplary award voting in this YouTube link. It is only the voting or the recommendation can only be done by the respective alumnus of NIH. He or she has to mention in that Google form his or her course, whether it's she belongs to a DPNH course or he belongs to a BHMS course or a MD course, the year of passing if the date is not there, and whom he or she wants to recommend for DPNH, for BHMS and for MD. And the committee headed by this year Dr. Ujjal Mondal sir and Professor Dr. Rajat Pal, Dr. Chandrasekhar Pore, and several others to name, they will be selecting from the submitted nominations or submitted recommendations. So please come forward, submit your recommendations for DPNH, for BHMS, and for MD course. There is another important announcement. Slowly but steadily, we are going to reach 125th episode of the CME. And today, Jayati, our beloved sister, Dr. Jayati Pal, had started with a sharing of clinical experience. We will be doing it, the 125th episode, immediately after the puja on 12th of October. And that heading will be Clinical Case Conclave, Success Stories in Homeopathy Part 2. We had done already in the 99th episode, and we are requesting 10 speakers to present one case each for at least 10 minutes, within 10 minutes. It was done in 25th August 24, and we'll be doing the 125th episode on 12th of October 25. So appeal to all the alumni across the globe, whoever is planning to present a case, you have one successful case or two successful case to be presented, come forward. We'll have 10 doctors, 10 alumni on screen on that day. One each will be presenting. So it's a very exciting and clinical case conclave on 12th of October, which is coming up. And we'll be having next episode of the CME. We had requested Dr. Amit Shani and Dr. Aakash Deep to be the speakers. We are waiting for their confirmation. Orko, is Dr. Aakash Deep is in the studio? I don't think he is there in the studio. I like to thank our beloved Krittika Di, really a Didi, a mother-like figure during our course. Once we were there in the first few years of NIH, and you all, Didi, had made us comfortable. We being the first batch, we really bow and with the love and affection we received from the seniors.
Thank you.
And we are proud. And we are proud to have such bright juniors like Jayati, who had never mentioned she has been the first girl on the university exam of final BHMS, which is a remarkable feat and achievement. She doesn't speak on her own, but it speaks through her knowledge sharing. So, Jayati, we will be requesting you in the future CME as a moderator, as a speaker in the coming years. Thank you all. And our pranam to our senior, Dr. Kalyani sir. And we had been guided by so many seniors, so many seniors like Dr. Aishwarya Das sir, Dr. Nirupama Mishra, Dr. Sunimal Sarkar sir, Dr. Samir Bhattacharya sir, Dr. L.M. Khan sir, Dr. S.Z. Khan, Robin Burman sirs, and several others to name. We request all our senior teachers, please guide us, please come forward and just drop me a message from your busy schedule. I'll be there in your clinic or I'll be contacting you over phone. So be our speaker on the CME. We want to learn. We are learner all and all through. We want to learn from all of you. And with this,
one minute, please. Bidyut.
Yes, sir. Please.
One minute time to encourage all of you. Regarding whom you are talking, that the first lady who stood first, his situation before admission in NIH was exactly reverse. He was sure that he is not fit for NIH. All the inspiration from one of my sincere, serious, respected Dada, is Jethu Mashai, Jethu, and I was in NI. Simply by inspiration, he got the chance, and later he became the best of the university. So this was history of Jayati Pal. You are sure that he won't get chance in NI. It's an achievement.
Actually, sir, that's why in drag picture of Baraita car, I stood first. Basically, I may be Baraita car. Those days I can
That
remember.
was the time in the late 1987, 90s that NIH used to have the drug drama competition quiz, which is now being popular in the western part of the country. But in NIH, on a regular basis, we used to stage the drug drama quiz. And today only we were discussing with Dr. Usha, Dr. Pralay, Dr. Trideep, Dr. Chandro, that few of our alumni had requested to stage the drug drama quiz or drug drama during the upcoming alumni meet in 12th December 2025. So again, that's appeal to all the alumni. Whoever is having any ideas, just pour in. We are ready to listen. And sir, as you know, with your permission, sir, on 30th of July, that is coming Wednesday, we'll be having the second physical meeting for alumni meet in NIH Alumni Office, in the NIH Alumni Association office within NIH campus from 2 p.m. We request all the alumnus and alumni, whoever are available, please make yourself available and be present at NIH to share your ideas, share your views, how to make the upcoming alumni meet a grand success. With this, I like to return to Orko for concluding the session. Over to you, Dr. Orko Mukherjee.
Thank you all. Thanks for watching. I hope you have enjoyed today's CME. And if you have enjoyed today's CME, please don't forget to like it, share it with your fellow alumni and your batchmates, and also with other students you like to do it. And also don't forget to click on the bell icon button to get updates on our future CME. And also join our WhatsApp channel. Over there, we also give the links to each and every CMEs and also give the updates about everything possible. So it's again, and we are trying to do our level best so that we can just go on with the process of auto e-generation participation certificate, e-participation certificate thing. We are trying to get back to it as soon as possible. And just give us some time, we will go through with it. And so with this, again, thanks for watching. And so we, all the links are given in the description, the Instagram link, our Facebook page link, and those who are watching on Facebook, go also just come to YouTube and you can watch over there too, where all the links are given in description below. And for Facebook people, it's given on the caption. Just go check on it. And with this, again, good night to all. See you in our next stream. Until then, it's me, Orko Mukherjee. Peace out.
This channel does not promote or encourage any illegal activities. All contents provided by this channel is meant for educational purpose only.